All right, so let's get, there's a few different questions from a few different people, but I know the numbers are out now. Once again, see record-breaking hospitalizations in ICUs. Is there any adjustments going on with hospitals based on the pressure we continue to see on the hospital system?
So we're going to give everyone a full briefing on all the elements of hospitals, just so there's an understanding on Monday. But this is something we are assessing multiple times a day to make sure we're in good shape. And to date, we're holding on to in the situation that we have, as I've said many times before, we've had significant bed capacity and we have equipment capacity, so all of that is not a problem. And right now, with the small adjustments we made last weekend to reduce some hospital slates in some particular hospitals in Fraser Health at Abbotsford, Royal Columbia, and Surrey, that was last weekend, we're doing fine. But obviously, 425 is a lot of people in hospital from COVID-19. That's among 8,800 people who are in hospital. So we look at both numbers, what we're seeing in hospital overall, and then the COVID-19 numbers. But this is something we've been actively planning. We had a lot of experience now with the impact of COVID-19 in hospitals. But there's no doubt this is extremely stressful for our staff teams and so on. And you saw yesterday those categories of people, 50 to 59, 60 to 69, and 70 and above, where we're seeing more hospitalizations. So we want to do two sets of things. One, continue to prepare, and we've planned in detail what we need to do in our hospital system to address this, and then of course reduce transmission in community. And really what we're seeing in hospital today is what we saw in terms of cases last week and the week before. So if we can continue to reduce case positivity as we've done this week, we're hoping that both of these actions, preparing our hospitals and making the adjustments necessary on the one hand, and on the other hand, continuing to reduce transmission through the measures we've put in place.
I'm sure you've seen the measures we were put in place in Ontario today. One of the things Premier Ford called for is support from other provinces. Does British Columbia have any help to give here in terms of sending healthcare workers to Ontario?
Obviously, we're supportive of the government of Ontario and the struggles that they're seeing, and just at a personal level, the Minister of Health in Ontario, Christine Elliott, is working very hard on all these issues. We're not going to be able to provide them with support, but we're going to continue to work together to support one another through this time. I mean, our resources are dedicated here in BC. We do have record hospitalizations, and we do have more capacity, especially in critical care, than Ontario, and that's been evident throughout the pandemic. But right now, needless to say, and you talk to any doctors and any nurses and any health sciences professionals, healthcare workers in BC, we really don't have anything to spare to send to Ontario.
I have a few different questions here about travel connected to what Premier Ford announced today. He's putting in substantial restrictions around the provincial borders, something that BC's been reluctant to do. Is there any thought that BC could reconsider it? Another piece of this is Dr. Henry said Thursday the virus is spent by travel. The Premier said that travel restrictions are not off the table. So what are we waiting here for here in BC around travel restrictions?
Well, I don't think travel restrictions are off the table. The Premier said that very clearly. And we have taken action on travel restrictions more than any other province. We did it on international travel. We involved the whole BC Public Service to do that. We did it way before everyone else, and we're now being emulated in some other places on temporary foreign workers in quarantine. And so we have taken significant action on travel issues in the past. The Premier has looked at this in detail, as has Dr. Henry, of course. And so I don't rule anything out, but I would say for this weekend, I want to make it clear, you don't need to avoid fines not to travel. The reason not to travel this weekend is to be respectful of other communities, to protect your own lives, protect the life of your family, to protect the health of your family, to protect the health of your neighborhood and community. So that's why we need to stay local this weekend. But clearly, all actions have been on the table and continue to be on the table, and we'll consider what they're doing in Ontario and potentially other options here in BC.
Yeah, because, the Premier mentioned he thought some legal advice that was problematic to restrict travel. Clearly it's not the case in Ontario. So is there
Well, we want to be effective. I mean, we saved multiple outbreaks by our action on temporary farm workers, so that was effective. We saved, I think, considerable transmission in BC through our efforts in supporting people who were quarantining in BC earlier in the pandemic. So I think the key is to be effective. That's what people want to see. Often other provinces and other jurisdictions, without being specific about them, have engaged in more high-profile measures that haven't been effective in reducing transmission or reducing social interaction. So we want to be effective, and the Premier has consistently advocated, sometimes a solitary figure, at federal provincial conferences with fellow First Ministers in favor of the discouragement of travel across the country. And there's a role for the federal government, which is the primary regulator of interprovincial travel, as you know. And so he's been an advocate of that, and certainly will consider all the options. But the key is to be effective. But the one thing I would say for everyone this weekend is if you don't need to travel, if it's not essential, if it's not for a serious family matter, if it's not for work, if it's not for a medical reason, then stay local.
One of the things Ontario is also doing is restricting outdoor activities, golf, tennis, soccer, camping. Are these options on BC's people looking at restricting outdoor activities?
Well, let's be very clear. Indoor activities is where we're seeing transmission. So the actions we've taken in the last couple of weeks, dating back to November, of course. I mean, we can only socialize with those within our household indoors, right? And in a very limited way outdoors. In addition to that, the new measures that were brought in on indoor dining. And then in workplaces, the measures that have been brought in, and then the application of those measures and safety plans, which is going on right now, especially in Metro Vancouver. So these are strong and powerful measures. And the key, again, is to be effective. And there is some good news, and I want to say some. The hospitalization numbers reflect the growth in cases last week. We have seen this week a decline in test positivity, which is good news. We've gone from 10.6 to 10.2. Today, I think the number is 9.65. And that the largest drops have been in Vancouver coastal health, and that's been significant, but all the health authorities have seen a decline. Though this is, I think, in part a result of what people are doing out there, which is responding and ensuring that they stay safe, and in response to some of the measures that Dr. Henry brought in 2 weeks ago. You want to ask about Moderna?
I do.
Oh, sorry. Okay.
Too many things at once, but I will ask this next one. Also, we'll get to vaccine. There's a few different vaccine pieces, so we'll get to vaccine in a minute. We're expecting this update, as you mentioned, on hospitalizations Monday. The restrictions also expire on Monday. There's been sort of this, boiling, we've heard the Restaurant Association says this. Should people expect to have the restrictions extended on Monday? And should people anticipate additional recruitment being put in place on Monday?
Well, of course, Richard, and you'll expect this, we're going to announce on Monday what we're going to do on Monday. But I would say this, 1,005 cases today, a record day for hospitalizations. So we need to take all of the steps necessary. Utilization of our immunization program, ensuring that people, a virus that transmits through social interactions, we continue to reduce social interactions, and that we make the adjustments necessary. And this weekend is part of that. What we really need this weekend, these very significant measures in every way, and I mean in particular with respect to indoor social activity this weekend, and the keeping in place and the strict adherence to workplace safety plans. We've got to make it all of our goal this weekend. If we do that, we can continue, I think, to reduce the rate of transmission in BC. And then we have to look at all of the options that are on the table for Monday. You've talked about the travel ones, and we're going to lay out in detail so people can see all of the details of what we're saying about hospitalization, why we've been able to withstand even more hospitalization than we expected without making very significant changes. Partly that's because we have basically no cases of the flu this year at all, which is something that is much better than anticipated, I would say, and has contributed to ensuring that we can continue to function well. As you know, we've done more surgeries this year than at any time in the history of the BC healthcare system in the last 6 months during a pandemic, so there have been great achievements. But all of that you're going to come forward with on Monday. But look, it's another case, day of more than 1,000 cases. Test positivity has gone down 5 straight days, but it's still way too high. So I think people will be in a position to draw their own conclusions.
We'll get to vaccine in a moment. Last question on vaccine from our friend in COVID, Vancouver. Online data yesterday indicated a rise in cases in the Hills Peace, including some industrial camps. Does this mean sites? Does it mean there are risk of? Does it mean sites? If so, how serious an outbreak?
No, it doesn't mean that. It means, but it means it's very serious. It's actually more, if you look at the 2 local health areas in the Peace, it's higher in the South Peace, the local health area in the South Peace, which is Dawson Creek. People should know that we have an olive community immunization in Chetwynd, in Tumbler Ridge, in Hudson Hope, which is a big hydro town, as you know. And we've been also using and had used AstraZeneca prior to the interruption, and for all people in workplaces over 55 in our industrial camps. But what we're seeing is in that region as a whole, not the industrial camps, but in the region as a whole, we're seeing a significant increase in transmission. I would say also in the region, although we have our clinics in communities such as Chetwynd and Tumbler Ridge and Hudson Hope are booked up, we've seen slightly less participation in vaccination, and we need to see that go up. And obviously we're concerned, and we want to encourage people, especially in Dawson Creek and in Fort St. John, when they're eligible to be vaccinated, to register and get vaccinated, whether they're in the 55 to 65 category or others. And certainly we're looking at that community. So there's a number of communities around BC that we want to look at in terms of based on what you saw yesterday. Obviously, we know Howe Sound and Whistler. You see Invermere and Windermere, which is in the Columbia Valley. You see Enderby, which is perhaps a surprise to appear on that list, where there's been significant transmission of COVID-19. And you see communities in and around Dawson Creek and Fort St. John. In those communities in the interior, there's significant transmission, and we're looking at ways to help address that through immunization, as we have in Prince Rupert and Terrace and other communities. And in addition to that, of course, the continuing effort in Surrey. As you know, we did all education workers in Surrey, fire and police in Surrey. We're looking at childcare in Surrey, and then other efforts to reduce transmission in Surrey. If you look at the overall case counts, Surrey's 10% of BC is 20% of our COVID-19 cases, and obviously that's a concern. But those are some of the communities that we're obviously looking at to use vaccination, as well as all the other things we're doing to help reduce transmission rates. And the good news is, where we've done that, especially in the Northwest, it's been quite successful. Witness Prince Rupert, but also Terrace and Kitimat and Nisga'a and other communities.
All right, so that goes very nice into the conversation about immunizing. So the Canadian Medical Association today sent out a public letter saying we need to look at a more federal approach around vaccine, including provinces with lower rates of transmission, moving some of their vaccine supply to provinces with higher rates of transmission, targeted towards hotspots like in British Columbia. Would BC be supportive of receiving vaccine from areas? Do you think this is a policy we should be thinking about federally to target the areas that are hardest hit and take vaccine from provinces that are not as hard hit?
Well, I would say this, that if you look at the bulk of the Canadian population, so BC, if you look at mortality, for example, BC has had, from the beginning of the pandemic, less than half the Canadian average in terms of mortality. Mortality is higher in Alberta, in Saskatchewan, in Manitoba, in Ontario, and in Quebec, which represents the bulk of the Canadian population. So I think one of the things we've done in Canada is focused on a fair distribution of vaccine, although we did favor, as you'll remember, the North at the beginning. So generally the north of Canada has been more fully immunized than everyone else. That was a decision taken because of the size of communities and because of the potential vulnerability of communities. So really, I appreciate the suggestion. I don't think there's a lot to redistribute. What we need is more vaccine now, and that's going to, and the federal government has talked about getting it. Frequently, though, we're talking about the deferral of vaccine for right now, for April, and getting more vaccine in June. And that sounds good at press conferences, and of course we'd like vaccine in June, we'd like it in May, we'd like it, but we'd really like it now. And you've seen the real machine that we put together, now buttressed by our network of pharmacies, to deliver vaccine in the province. A record amount of vaccine delivered yesterday, and obviously we have way more capacity than we have vaccine. So we're hoping to really push what we have in the next few weeks, because that has an important impact on hospitalization. And we believe and we hope that the focus on those areas, right now there's a focus on the pharmacy campaign from 55 to 65. You see the rise in hospitalization amongst those people. And I encourage people, if they can find an open appointment, to get immunized with AstraZeneca. Our vaccination of clinically vulnerable, which is now more than half of the people in that category have been vaccinated, and then well over half of people over 65 have been vaccinated. So these are the areas where we see hospitalizations, and we believe that vaccination can help reduce hospitalizations in addition with the other measures we're taking.
Will the Moderna shortfall be made up doubling the Pfizer supplies coming next month?
Well, again, you know, it would be nice to have more vaccine now. It would. But we've got to deal with the vaccine we have. I'm glad the federal government is working hard to get more Pfizer in response to some of the inconsistency around Moderna. People should know that we received, the beginning of the day today, 94,000 doses of Moderna that actually arrived in BC. We had been down to basically 15,000 doses, so that really helps. We're expecting the remainder of the 105,600 doses, I believe, today. So then we're going to have this week's Moderna production. It's great to have Pfizer in May, but if we had, say, I don't know, next week 100,000 additional doses, we could sure use it. That would make a significant difference, especially targeted in some of the areas of high risk and high transmission.
What are we doing to push Ottawa to more quickly get the vaccine to us?
Look, we talk to them every day, but they don't need to be pushed. You know, this is a pandemic. It's been a pandemic for a year. They know that we need, and everyone needs, to get vaccines into people's arms as soon as possible. That will be one way to protect people, everyone in the country. Today we're up near 28% in BC, which is more than we expected to be with first doses. And that's partly because of the strategy and the decisions put in place by our provincial health officer, who's led the country in this regard. But we're up to 28%. But if we can push that higher and more quickly, then that would be great. I think Ottawa's doing everything they can to get more. You know, the only small frustration I'd have with them is their tendency to celebrate when vaccines arrive and to be critical when, in fact, we're doing an outstanding job getting vaccine to people's arms. But that's just small stuff from them. What's important is they're working very hard to get more vaccine. Obviously, the fact that we're seeing an interruption in Moderna affects us, but we're adjusting, we're adapting. We adapted on AstraZeneca in a very fast and I think remarkable way, and we're going to continue to adapt. And as there are changes, say more AstraZeneca, the possible arrival of other vaccines, of AstraZeneca USA vaccine, the possible arrival of more vaccine, potentially Johnson & Johnson, all of those will adapt and will go forward. And our goal is, when the vaccines arrive, is to get it in people's arms. And you can see with what we've done with Pfizer and Moderna that that's happening. We are going to be close to out of Pfizer by the time more Pfizer arrives. And that's our goal with our vaccine campaign. So in the next couple of weeks, you're going to see a real effort to use all of the AstraZeneca we have to get it in people's arms, because the sooner that happens, the safer all of us are. And if we can target people who are more likely to be in hospital, which is what we're trying to do with our 55 to 65 campaign, or our 55 plus campaign for AstraZeneca, all the better.
Talking about adapting, is there any thought being given to changing the percentage of vaccine allocated to the hotspots compared to the age-based? I think Dr. McRae said yesterday 90%, 10%. Is there Pfizer and moving it towards provincial workers or hospitals compared to the age-based program?
Well, we're doing that, and we've done that from the beginning, and we hope, we'll see what happens with AstraZeneca, that we'll be able to have some more flexibility with AstraZeneca as well in the coming weeks. There will be some recommendations from the National Advisory Committee on Immunization, and so we'll look at that. But the evidence is, if you look at what happened, the evidence in terms of hospitalizations and critical care is that the age-based program is exactly what we should be doing, which is protecting those most vulnerable to hospitalization at a time of rising hospitalization. So the core of our program, age-based, clinically vulnerable, Indigenous people, that's been our goal from the beginning, and the evidence has shown it was the right approach, that it's working well, it's being delivered well on the ground. We're going to take some and focus on hotspots, of course, but the core of our campaign is going to remain the same.
AstraZeneca, where are we at with administering it? How many shots can be given out a day? How many are actually given out? This news organization has seen that one pharmacy told they have 50 doses and very few people on them. Are you worried about AstraZeneca hesitancy to be behind in actually administering AstraZeneca based on what we have?
I think I think it's close to 123,000 British Columbians have had a dose of AstraZeneca, which is a lot of British Columbians. And I think the pharmacies are doing a good job. 35,000 of those doses, if you'll remember, were before the change in guidance around AstraZeneca. So those went to basically essential workers or workers in different work categories, to hotspots and other things. But since we began the pharmacy campaign, I think we're in the neighborhood of 90,000 so far. And I think we're going to work our way through that amount. Some pharmacies have all their spots filled up. Others have a little more spots available. Well, I encourage people, if they have a chance, to look around, especially at smaller pharmacies, which sometimes have more vacancies. Because sometimes people get frustrated. They only call, now I'm going to call the brand names, and they're going to get me in trouble, but Save On or London Drugs or Shoppers or PharmaSafe. But some of the smaller pharmacies also have a larger supply of appointments, and I'd really recommend, especially if you live in Vancouver Coastal Health or Fraser Health, with the level of transmission right now in those two health authorities, I would, if I had a chance, if people have a chance to do the AstraZeneca, I think they should do it.
Last one for you, and I'm not sure, I don't know, I can't find who this is from, so you'll help correct here, because I'm not sure this is completely accurate, but I will read you the question as it was sent to me. The vaccine gap is growing. We were averaging 200,000 vaccines a week more than we were administering, and now it's closer to 400,000. But the CDC's own data shows we see only 159,000 vaccinations last week. Why are you blaming the federal government's for supply shortages slowing down the rollout when it looks like we're not keeping up with what's coming in?
So, Pfizer, we had 880,000 doses. We received we received 138,000 this week. We have about 70,000 left. So we've used all the Pfizer they sent us, and then we've almost used the Pfizer they've sent us Monday, Tuesday, and Wednesday. So we've used it all. On Moderna, until the Moderna arrived yesterday, and I think it's a little much. This is what the federal government does. They send us 105,000, and then they say we have 105,000 in fridges instantaneously. We had about 20,000 doses of Moderna left when that 94,000 arrived yesterday, so we used it all. There is more AstraZeneca, because that came in a big bolus and we had to change strategies, but that's being used up. Yesterday or Wednesday, we had a record day, more than 10,000 of our shots were AstraZeneca through pharmacy. I think it was 9,000 on Thursday. So slowly but surely, that's moving up as well. So we're using all the vaccine. We're certainly using all the Pfizer and Moderna. The AstraZeneca, we had a change in guidance, and then 188,000 arrived, and we're working our way through that. So the question is absolutely wrong. If we had 1 million more doses from the federal government, we would distribute those doses into people's arms. We have very significant capacity. What we don't have yet is enough vaccine, but the federal government's doing everything they can to get us as much as possible.
All right, Minister, thank you for doing this. We'll talk to you on Monday.
And I might add, people write columns about me not blaming the federal government, so I'm not sure about that. I don't want to footnote this with those columns. I just want to say that in passing. Take care. Yeah.